Mesothelioma is an aggressive form of cancer that develops from the mesothelium, which is a protective lining that covers most of the body's internal organs. The standard treatment options for mesothelioma include surgery, chemotherapy, and radiation therapy. However, these conventional treatments can be very expensive and are not always effective for all patients. As such, some mesothelioma patients may be interested in exploring less expensive alternative or complementary treatment options. Here are some alternatives that have shown some promise based on past research and clinical experience. Natural supplements, certain vitamins, minerals, herbs and other natural products are being studied for their potential anti-cancer effects against mesothelioma. Some supplements that have shown some early promise include turmeric, resveratrol, selenium, vitamin C, vitamin E, and various medicinal mushrooms. However, evidence is still limited and interactions with standard therapies need further research. Supplements tend to be much less expensive than conventional drugs, but patients should speak to their oncologist before taking any supplements during cancer treatment. Hyperthermia therapy. This involves applying gentle heat to targeted areas of the body containing cancerous tumors. Heat has been shown to make some chemotherapy drugs more effective and cause cancer cell death. Hyperthermia is often used as an adjunct or complementary treatment along with chemotherapy or radiation, and some studies have found it can help improve mesothelioma patient outcomes when combined with standard care. Equipment required for precise localized hyperthermia can be costly but is still generally less expensive than many chemotherapy drugs or surgery. Oxygen therapies. Delivering extra oxygen directly to tumors via various methods is an area of active research that may help fight hypoxic, low-oxygen, tumor environments which can aid cancer growth and treatment resistance. Specific oxygen-based therapies being investigated for mesothelioma include hyperbaric oxygen therapy, HBOT, oxygenating normal baric respiratory therapy and inhaled oxygen therapies. While high-grade medical equipment is required, some early research has found oxygen therapies may help improve responses to chemotherapy when used together. Costs for these therapies can range from a few hundred to a few $1,000s depending on the specific method. Mistletoe extract therapy. Mistletoe extracts from various plant species native to Europe and Asia have long been used in alternative oncology as complementary cancer treatments. Specific peptide compounds in mistletoe called lectins have been found to stimulate the immune system and have direct anti-tumor effects. Mistletoe extracts are available as subcutaneous injections or oral supplements, and some European studies have found mistletoe extract therapy may help improve quality of life and survival when added to standard mesothelioma care. Costs for mistletoe therapy tend to be hundreds to low thousands of dollars annually depending on the dosage protocol used. Chinese herbal medicine. Traditional Chinese herbal formulas customized for individual patients based on traditional diagnostic patterns are another area of natural medicine being explored as an adjunct treatment for mesothelioma. Specific formulas containing herbs like astragalus, lycium fruit, Rehmannia root, Scutellaria abicalensis and Ganoderma lucidum are being studied in combination with chemotherapy for possible benefits. While the mechanism of action for many Chinese herbs against cancer is not fully understood, costs for Chinese herbal medicine made by licensed practitioners tend to be affordable, often just a few $100s per year of treatment. Ayurvedic medicine. The traditional medicine system of India, Ayurveda, also employs botanical and supplemental therapies that may aid immune function and reduce toxic side effects during cancer treatment based on individual constitution. Formulas containing herbs such as Wadania somnifera, ashwagandha, Thymus purpurea, curcuma longa, turmeric, Mama urtica trantia, bitter melon, and Embuca officinalis have shown anti-cancer effects in preclinical research. Adding Ayurvedic herbal support and detoxification techniques like panchakarma may help some patients tolerate conventional therapies better at lower costs of a few $100s or less annually depending on the specific Ayurvedic practitioner and protocol used. Lifestyle and dietary changes. Adopting an anti-inflammatory, antioxidant-rich whole foods diet, staying physically active, managing stress, Getting adequate sleep and practicing relaxation techniques are also important aspects of natural cancer supportive care that any patient can do at low or no cost. Eating more plant-based foods like fruits, veggies, whole grains, and omega-3 rich fish while limiting red meat intake and refined carbs may aid mesothelioma treatment by reducing inflammation and improving overall health. While more research is still needed on many alternative approaches for mesothelioma, integrating select less expensive natural therapies that have a reasonable scientific rationale as part of a complementary treatment plan, under the guidance of a licensed integrative or naturopathic oncology provider, could potentially help improve quality of life and treatment outcomes for some mesothelioma patients. Natural options are generally lower risk than conventional treatments, but patients are still advised to not discontinue standard medical care without consulting their oncology team. An integrated approach may offer patients a lower-cost way to help support the body during conventional